Hello and welcome to the Imaging Wire Show. My name is Brian Casey, Managing Editor of the Imaging Wire. We've got a great episode for you today. Our topic is improving patient care with AI and a CT fleet approach. And our guests are Dr. David Furman. He is Medical Director for CT at St. Luke's University Health Network, and Jay Anders, Vice President of CT for the U.S. and Canada at GE Healthcare. Gentlemen, thanks for being with us today.
Thank you.
So I'd like to start with introductions. Dr. Furman, can you go first? Can you tell us a little bit about yourself and your role at St. Luke's?
Sure. I've been with St. Luke's since about 2004 after doing a cross-sectional fellowship at Mount Sinai. And we've been doing coronary CT early on in my career. And I became the medical director for CT in 2007. And for that time, we've been expanding. And so I've kind of gone to oversee an increase in the number of hospitals and scanners that we've been implementing. And so my role is for sort of overseeing the protocols and practices of the CT department.
Great. Jay, what about you?
Yeah, I've been with GE Healthcare for about 22 years now. In my role today, I'm really responsible for making sure GE Healthcare is taking the best possible care of our clients in the United States and Canada. And equally important is making sure that I take what I hear from our clients back to our global product management teams and our global CT team to make sure that we're building the products and we're designing the products to best serve the needs of our customers and their patients.
Great. Now, Dr. Furman, CT is kind of known as radiology's workhorse modality, and it just kind of does everything. But as I'm sure that you know, operating a CT service is far from easy. Can you tell us a little bit about the CT service at St. Luke's?
Sure. As I mentioned earlier, we have been expanding quite rapidly, in my time with the network. And that has brought with it a lot of opportunities and a lot of challenges. But, we've expanded to the point where we're doing, hundreds of CT scans every day over multiple sites. So it's challenging from that perspective, and it's also challenging because we have increased the services that we offer. So as we've increased in size, we've gotten more subspecialty positions, and that requires more subspecialty imaging. So,
how many CT scanners does St. Luke's operate throughout the system?
We currently have 26 scanners in our network,
okay.
And by the end of the project that we're involved with GE, and now we should have 29.
Okay. And do you know about how many scans a day per scanner your service is averaging?
Yeah, in the last year, we did about 225,000 in the year. So something between 600 and 650 a day on average. So
awesome.
Yeah, it's a lot of scans.
Busy. That's a busy service.
Yeah.
Now, CT is so versatile and it's doing so many different things. How has the clinical mix in the CT service at St. Luke's changed over the years? What kind of trends are you seeing?
Well, part of that is, we started out with 2 hospitals and we were not quite a tertiary care center. We were big, but now as we've increased the number of hospitals and our volume has increased, we also have a lot of subspecialty docs that require very specialized kind of CT imaging. So we're seeing a lot more demand for coronary CT imaging, both coronary CTA and structural imaging. We need to be able to do CT angiography prior to transcatheter aortic valve repair. We need to be able to provide guidance for navigational bronchoscopy. We need to do stroke imaging. We need to do all these things that a large subspecialty tertiary care hospital network needs to be able to do.
Yeah. And what are some of the biggest challenges that you face in the CT service there?
Well, a lot of the challenges revolve around the demand. So as we're expanding, we need to hire more techs. We need our techs to be able to do all of these complex imaging modalities, and we need to be able to standardize that service across our network. So that's one challenge. Another challenge is that we need to make sure our image quality is at a standard that we are comfortable with. And we held ourselves to a pretty high standard for image quality. And then finally, we're doing over 600 scans a day. We need to make sure our radiation dose is low because cumulative radiation dose is important. And so those are all challenges that we grapple with for patient safety and also for the comfort of our radiologists. So they're happy with what they're putting out.
Yeah. Now, prior to this relationship that you've signed with GE, which we're going to go into more detail in a second, you were operating scanners from multiple different vendors, correct?
Correct. Yeah, we had always been primarily GE place. So most of our scanners have been GE scanners, but we had acquisitions where we took over other hospitals, small hospital sites or outpatient imaging centers. And so we had some Philips and we had some Siemens. And then also we had GE scanners from different generations. So we'll have a different generation scanner, and not every site would have the same capabilities. So that was a challenge too. That was something that we were hoping to address with our new platform deal.
Great. Now let's talk about that deal in a little bit more detail. Jay, can you describe kind of the relationship, the partnership that GE has signed with St. Luke's, and kind of what some of the particulars are that are involved in that?
Yes. So with this partnership, it was really looking at the entire fleet. So how do we look at their entire assets? And as Dr. Furman pointed out, the kind of the diversity and complexity that they had within their fleet, how do we bring that all up to a standard? So part of it was, absolutely putting the latest technology, the latest platform in these individual sockets. But then the second piece of this was, how do we make sure that stays updated over time? So clients are holding on to scanners longer than they ever have, and making sure that you buy not only the latest technology today, but that you're going to have a CT that keeps getting better with time is incredibly important. And I think the other piece of this that was unique and really important as well, both to us as well as to St. Luke's, is we also provided a dedicated on-site resource to St. Luke's. So we have someone there working with them, hand in hand with them, to make sure that they are understanding the technology, maximizing the utilization of kind of the high-end clinical capabilities that Dr. Furman pointed out, and making sure that they're there to support their team in any way that they're looking for.
Great. So you guys signed a partnership, involves the provision of 21 CT scanners to St. Luke's. Is that correct?
That's correct.
21 CT scanners in a deal that's worth $29.4 million. So this is a really big deal. And so St. Luke's is going to be able to standardize its entire platform using GE technology. Is there a particular scanner that was involved in this deal, or are there multiple different kinds of GE systems here?
It's primarily our latest premium platform, the Revolution Apex. And within that platform, and the reason we refer to it as a platform is there's multiple configurations. So you buy the technology that you need today for the types of services or exams you want to provide in a particular location, with the confidence that you've got an in-field upgrade path should those needs change. So with this platform, you can really scale the detector size. So if you have a setting where, maybe you're just going to be doing routine work every day, workhorse applications, maybe you buy a 4-centimeter detector that can do that work very well. And if 5 years down the road, they decide they're going to bring a cardiac CTA service line to that location, and they really want to maximize the capabilities of that scanner for that particular application, that they have the optionality to upgrade in the field to a much larger detector for whole heart coverage.
So there's kind of an upgrade path to different technologies.
Absolutely.
Now, Dr. Furman, can you talk a little bit about how standardizing your CT fleet on a single platform is going to be helping you, do the job that you need to do?
Sure. Yeah, it's gonna help us on a lot of levels. One of the big challenges for spread out networks and radiology groups is making sure that the CT protocols that you're using are the same at every site. And there's some research that was published about 8 or 10 years ago by UCSF that showed that in the UCSF network, they found 7 different protocols for just the same kind of scanner. And that's something that we work really hard not to do. But even with dedicated clinical CT specialists, we have difficulty standardizing all of our studies because we're losing the ability to do the same thing at the same site with different scanners. So it's a Toshiba at one place, Philips in another place. So that's one thing. Another thing is that the way the CT techs interact with the scanner itself can be different at each site. And, we're trying to staff multiple sites, and that's a challenge. And so, a tech that works at one site can't work at another site unless they learn how to do it. And even if you both have GE scanners, if one scanner is a little bit different from the other and the technologist is asking questions and going slower than they normally would, that's another challenge. So that kind of standardization, having the same scanners at each site is great for the techs, it's great for the patients, and then ultimately it's going to be great for the way that we advance in the future. So Jay was talking about how the scanners are upgradable, so we get new when we have new applications that we add to the scanner, we'll have it at all the sites. So previously, we started doing coronary CT at one site in our network, and that was the site we did it at. We made patients come to the place that had the coronary CT scanner. And in the future, our hope is that we'll be able to offer it to all of our patients rather than just the ones that can make it to that site.
Great. Jay, can you go into a little bit more detail on how the software upgrades and the technology upgrades from the GE side will be handled? Is it kind of a situation where somebody at a GE headquarters pushes a button and pushes out all this software, or is it something a little bit more involved in that?
Yeah, so this is a subscription offering, a digital subscription offering for our clients. And so the idea is, historically, the way that a client would acquire and use a CT scanner is they'd buy one, they would use it for a period of time, and then they would replace it. And again, clients are holding on to CT scanners for longer than ever. So now there's really a chance, if you don't have a mechanism to get upgrades, it's really easy for your technology to become obsolete. And I think Dr. Furman's point was excellent in that no one's really in a position to replace all of their fleet at the same time. So even if you're buying the exact same model of CT from the exact same vendor, you expect us to innovate. So when we come out with next year's model, it may have a new feature or a new functionality that wouldn't be applied to your old one unless you paid for an upgrade. Within the subscription model, instead of buying that software upfront as a capital expense, you subscribe to it. And then the client is entitled to, as new capabilities become available, they're entitled to those upgrades. And so really focused around a couple of areas. One is clinical excellence. So how do I really improve image quality, minimize artifacts, reduce dose, but then also a really heavy bend towards operational efficiency. How do we embed AI on device to really simplify and standardize the workflow of a technologist so that, as Dr. Furman pointed out, they have turnover or new technologists. We really raise the average. We really raise the average performance of all of their technologists, regardless of what site they're at and regardless of how new they are to the organization. So these upgrades are coming out once or twice a year. And yes, the idea is that we will be pushing those out as soon as they are available so that St. Luke's and team can maximize their capabilities.
Okay. Jay, you mentioned AI, and there's been so much talk about AI in radiology in the last couple of years. And, on Imaging Wire, we're going to be publishing a story on the use of AI to analyze for opportunistic screening of fatty liver. And so there's so much potential for AI. Can you talk a little bit about what maybe GE is doing in AI for CT, and then Dr. Furman, I'll ask you about what are your plans for AI? So what sort of things do you think that GE might be able to push out to its customers in the realm of AI for CT?
Yeah. So first off, I think it's important to note that GE Healthcare has been recognized really as a leader in AI by the FDA for FDA approved AI applications. So this is an area that we have a huge focus on as a company, not just within CT, but more broadly across the organization. This is a key focus area of ours. Is yes, you have to have great hardware, but the speed of innovation in artificial intelligence is moving at a breakneck pace. So as I mentioned, a lot of the focus might be around improving images. So one of the areas that we look at is we've got deep learning image reconstruction, what we call our true fidelity images. And the purpose of that was when we went to our iterative reconstruction techniques, that was meant to reduce dose. But those iterative reconstruction techniques, kind of regardless of vendor, did change the complexion of the image a little bit, changed the texture. And in some, radiologists did not necessarily like the texture of those images. With something like True Fidelity, the idea was to keep the dose really low, but to recuperate the original texture of images from a filtered back projection look. So that's one way that AI is being used. Another is a very practical application towards how do we improve operational efficiency. And so that can happen in a number of ways. One is auto-positioning the patient. So you put the patient on the table, ensuring that they go into the center of the bore so that you maximize image quality and you lower dose. There's also an opportunity really on the back end, on the post-processing side. Sometimes when you're doing something like a spine, and it's a kyphotic spine, and there's a lot of reformats that a radiologist might want to look at in order to have a confident read, a confident diagnosis, those reformats can take 5, 10, 15 minutes sometimes for a technologist. How do we use AI to completely automate that process so that once the scan is completed, it automatically grabs the images, does the reformats that the radiologist wants, and automatically sends it to their PACS for them to be ready to read? So ideally, what we're looking to do is really improve workflow from order all the way to report. CTs are pretty fast, but there's a lot of opportunity on the steps before and after to really speed that workflow and really improve operational efficiency for clients.
Great. Dr. Furman, what's the position at St. Luke's on AI? Is this something that you guys are really interested in looking at? Do you see it more as a workflow enhancing tool, a data reconstruction tool, or interpreting images? I mean, how do you guys plan to use AI in the?
Yeah, well, it's funny you asked that. Our network is very committed to radiology, improving our quality and improving our efficiency through any means necessary. So we're really lucky in that way. We're very fortunate. So we do investigate a lot of AI opportunities. If you'd asked me before we had the this first scanner installed, what do I think AI will be helpful for us? I would have said interpretation, because that's the part that I was involved in. But Jay kind of just mentioned some of my favorite things about the new scanner, which I'm really excited about. That deep learning iterative reconstruction is really incredible. Now, I thought Acer was pretty good, but there's a definite improvement. The AI that does the dose reduction and basically the image quality for the deep learning iterative reconstruction is really impressive. So I think he's right. I think there's actually a lot of there are a lot of creative bioengineers coming up with incredible advancements in AI that can help us on all those different levels. So for us, when we're interpreting the images, we mostly think of AI as helping us find lung nodules, helping us find breast lesions on mammography. But there are absolutely a lot of opportunities there, and I think the network had a lot of foresight in being able to enter into this smart subscription agreement, because there's going to be a lot of changes and there's going to be a lot of innovation in a very short period of time. So,
yeah, definitely. Now, what's the status of the implementation right now, Dr. Furman? I think you mentioned that at least one scanner has already gone in.
Yeah, we have one Apex Revolution installed. Luckily, it's at campus I'm at the most frequently, which is great. And it's incredible because I kind of knew what we were getting because I was involved in all the discussions. So I had a sense of what we were getting, but we have purchased upgraded CT scanners before, but I think this is by far the greatest leap in technology that we've had in CTs since I started in radiology. The image quality is great. We're doing coronary CTA, and that is vastly improved, which is one of our main goals. And the technologists absolutely love the ability to be in the room and set up the scan while they're with the patient. So it goes faster for them. It's easier for them. We have 2 scanners at that site, and the technologists, of course, vastly prefer to use the faster scanner where they can be with the patient. So that's where we are now. We have the construction on a second room is mostly done. So we're going to have the second installation in the next couple of weeks, and then in January we're going to have our first 16 centimeter detector unit installed at our largest campus.
obviously it seems like this deal has a lot of benefits for GE, in terms of the number of scanners it's shipping. But do you see this sort of platform approach, this kind of fleet approach to CT as being something that's going to become more commonplace in radiology?
Yeah, absolutely. I've been in my role a little over 5 years, and I would say the number of conversations I've had with clients around fleet management has really grown exponentially in the last couple of years. And I think you've got a situation where there's been a lot of consolidation in the healthcare marketplace, and really capital-intensive projects that providers have prioritized. And maybe sometimes upgrading your CTs has taken a little bit longer than usual. And we've seen that. Again, the average lifespan from 15 years ago, now it's like on average 12 years. So folks have absolutely drawn out the useful life of their technology, and specifically of their CTs. And that got exacerbated a bit during the pandemic, where folks really locked down on spending capital. And I think we're at a bit of a point where continuing to wait is not really an option. And I think providers realize that the traditional model of living, when it's ready, kind of on a one-off basis, on more of a transactional basis, is not a sustainable way to manage a large and growing fleet. So they really need to take a holistic approach about how am I going to update my fleet, and then how am I going to have a sustainable path to keep it updated so they don't run into this problem again 15 years from now.
Perfect. Now, there is one kind of interesting wrinkle to this deal, and that is that St. Luke's is planning to launch a radiologist residency program in 2023. Dr. Furman, do you see this partnership affecting that program?
Yeah, well, I think it was important that we entered into it now. When we did, our residence started just this past July 1st, so just a couple of weeks ago, and they are going to have some hands-on experience with some of the technology that they're going to need to know about. And I think it's really important for them to learn how to read dual energy scans, how to read coronary CT angiograms, how to read these TAVR studies that they're going to have to read once they're out in the community. And, could we do them previously? We could, but it was a lot harder. And it was a lot more spotty. Our coverage, our ability to offer in different locations was a lot more spotty. So I think they're going to get a much better experience because they have the access to this kind of imaging. So
it'll be great to see how that program develops. We certainly need more radiologists.
Yeah, hopefully they won't be disappointed when they get out of the community and they see what else is going on out there. And I hope they won't complain about image quality at new residency, after they leave the residency.
Right. All right. Well, thanks so much for being with us, Dr. Furman and Jay. It's been a pleasure talking to you both.
Thanks for having me.
Pleasure to be here.
All right. Signing off for the Imaging Wire. My name is Brian Casey.